Diana fainted 5 times during her wedding dress fitting. Designers were panicking, measurements kept changing. Philip shouted at this self-indulgent nonsense. Royal wives don't have nervous breakdowns. While Elizabeth coldly added, weakness is not acceptable. Diana realized she would get no support from her family and couldn't control her eating disorder. In February 1981, Diana Spencer came for her final dress fitting for her wedding at St. Paul's Cathedral. The magnificent wedding dress, designed by the Emanuel brothers, hung waiting, breathtaking, with its ivory silk and lace details. "Princess, could you please step onto the platform?" Elizabeth Emanuel guided gently. Diana swayed slightly as she stepped onto the platform. She had been feeling constantly tired in recent weeks. "Diana, darling, you look a bit pale," David Emanuel noted with concern. Diana tried to smile. "Wedding stress, I suppose." Elizabeth Emanuel took the tape measure. "Let's take measurements. Waist, 24 inches. Last week it was 25 inches. Diana's heart raced. She had been struggling to eat in recent days. Every bite required effort. "That's a good thing, isn't it?" Diana asked hopefully. David Emanuel looked worried. "Well, the dress has already been adjusted for 25 inches. Now we'll need to alter it again." As Diana stood on the platform, she began to feel dizzy. The room felt like it was spinning. "Princess, are you all right?" Elizabeth Emanuel noticed Diana looked pale. Diana's words trailed off. Suddenly, everything went black. Diana collapsed on the platform. The Emanuel brothers rushed over immediately. "Someone call a doctor!" David shouted. Elizabeth Emanuel lifted Diana's head. "Princess, can you hear us?" Diana slowly returned to consciousness. "What happened?" "You fainted, darling. Just rest." Diana was confused. This was one of the episodes she'd been experiencing frequently lately, but she couldn't tell anyone. "Maybe low blood sugar," Elizabeth Emanuel suggested. "When did you last eat?" Diana tried to remember. "After lunch yesterday? Or before?" The days had become blurred. "This morning," Diana lied. Dr. Alan McGlashan, the royal physician, arrived 30 minutes later. Diana was still resting in the dressing room. "Princess, please describe your symptoms," Dr. McGlashan started in a professional tone. "Just tired. Wedding preparations are overwhelming." Dr. McGlashan examined Diana. Blood pressure low, pulse irregular, weight loss obvious. "When did you last menstruate?" Diana felt uncomfortable. "A while ago. Stress affects it." Dr. McGlashan took notes. "Any appetite changes?" "Sometimes eating is difficult." "Nausea? Vomiting?" Diana hesitated. "Sometimes." Dr. McGlashan gave Diana a sharp look. "Princess, I need honest answers. Are you deliberately restricting your food intake?" Diana became defensive. "Of course not. Wedding stress is causing problems." Dr. McGlashan was unconvinced but didn't press further. Challenging royal family members was a delicate matter. The following week, Diana returned for the adjusted dress. But the situation had worsened. "Princess, the measurements have changed again," Elizabeth Emanuel worried. "Waist is now 23 inches. Diana was secretly pleased. She finally felt some control. During the dress fitting, Diana felt dizzy again. This time, she rushed to the bathroom. The Emanuel brothers waited anxiously outside while Diana struggled inside. She had tried to eat that morning, but her body had rejected it. When she came out of the bathroom, her face was white, hands shaking. "Princess, we should postpone," David Emanuel suggested. "No," Diana panicked. "Wedding preparations must continue." That evening, Charles organized a family meeting at Buckingham Palace. Elizabeth, Philip, Charles, and Dr. McGlashan were present. Diana has health concerns, Charles began. Wedding preparations are affecting her. Elizabeth spoke firmly. Royal brides historically manage stress better. Diana is young, but should be strong. Philip was impatient. What exactly is the problem? Wedding nerves? Dr. McGlashan was cautious. The princess shows signs of stress response, weight loss, fainting episodes, irregular eating patterns. Philip was irritated. Self-indulgent nonsense. Royal wives don't have nervous breakdowns. Elizabeth added coldly, "Weakness is not acceptable in this family. Diana must compose herself." Charles was defensive. "She's doing her best." Philip interrupted. "Her best is not good enough. The public is watching. Diana cannot appear weak or unstable." Dr. McGlashan realized the political situation. The truth about Diana's eating disorder could damage the royal reputation. "Your Majesties, perhaps we should consider this a temporary adjustment disorder. Wedding stress is common among young brides." Elizabeth was relieved. Temporary? With proper management, yes. Some medication might help with anxiety. Philip approved. Good. Fix whatever's wrong and move forward. Dr. McGlashan prescribed mild sedatives for Diana, but didn't address the real eating disorder treatment. Protecting the palace image was the priority. Diana realized no one understood the real problem. The family saw it as weakness. Doctors were covering up. Charles was clueless. That night alone in her room, Diana looked at herself in the bathroom mirror. Thin face, hollow eyes, but the wedding dress finally fit properly. "At least I can control this," she whispered to herself. At the third fitting appointment, Diana collapsed again. This time, the Emanuel brothers were seriously alarmed. "This is the third time, Princess. You need medical attention." Dr. McGlashan was called again. This time, he conducted a more thorough examination. "Princess, your weight has dropped significantly. What's your current weight?" Diana was reluctant. "I don't know exactly." Dr. McGlashan used the scale. 7 stone, 10 pounds. You've lost over a stone in 2 months? Diana panicked. "Is that bad?" "For someone your height, yes. Combined with fainting, irregular periods, this suggests a serious eating disturbance." Diana became defensive. "Just wedding stress." Dr. McGlashan was direct. "Princess, are you inducing vomiting?" Diana fell into shocked silence. "Are you using laxatives, restricting food deliberately?" Diana's tears started. "I don't know what you mean." Dr. McGlashan reported back to the royal family. This time, the concern was real. "Weight loss this dramatic is concerning. The princess needs psychological evaluation." Philip exploded. "Psychological? Are you suggesting Diana is mentally unstable?" "Sir, eating disorders are serious medical conditions." Elizabeth interrupted. "Dr. McGlashan, let me be clear. Diana cannot be labeled as mentally ill. Public perception is critical." Charles was confused. "But if she needs help?" Philip was firm. "She needs discipline, not therapy. Royal duty means sacrificing personal comfort." Elizabeth agreed. "Diana must understand that royal women cope with pressure. This self-indulgence ends now." The next day, Diana was summoned to Elizabeth's private sitting room. Philip, Elizabeth, and Charles were present. "Diana," Elizabeth began coldly, "your behavior is concerning." Diana was nervous. "I'm trying my best, Your Majesty." Philip was harsh. "Your best is pathetic. Fainting at dress fittings? Losing weight dramatically? This is embarrassing." Diana was in tears. "I can't help feeling unwell." Philip was furious. "Can't help? This is self-indulgent nonsense. Royal wives don't have nervous breakdowns." Elizabeth added icily, "Weakness is not acceptable in this family. You represent the crown now. Personal problems must be controlled. Charles tried to intervene. Perhaps Diana needs support. Philip turned on Charles. She needs backbone. Stop coddling her. Diana realized she would get no compassion from the family. Her mental health struggle was seen as weakness. Shame was given instead of support. Dr. McGlashan had been called to Elizabeth's private study to brief about Diana's medical condition. Elizabeth sat behind her desk, looking official, but worried. Dr. McGlashan, please sit. Elizabeth indicated a comfortable chair. Thank you, Your Majesty. Elizabeth went straight to business. What is your report on Diana's condition? Dr. McGlashan hesitated. He was caught between professional integrity and royal expectations. Your Majesty, I'm observing concerning symptoms in Princess Diana, such as dramatic weight loss, approximately 14 pounds in 6 weeks, fainting episodes, irregular menstrual cycle, fatigue, and... Elizabeth interrupted. These could be wedding stress symptoms, couldn't they? Dr. McGlashan was careful. Possible, Your Majesty, but the magnitude is concerning. Elizabeth leaned forward. Dr. McGlashan, let me be direct. What exactly are you suggesting? Well, Your Majesty, the combination of symptoms suggests a possible eating disorder, specifically bulimia nervosa. Elizabeth's face hardened. Eating disorder? Yes, ma'am. The princess admitted to difficulty eating, possible vomiting episodes, and... Elizabeth stood up sharply. Dr. McGlashan, stop! Dr. McGlashan was surprised. Your Majesty? Are you suggesting that the future Princess of Wales is mentally ill? Dr. McGlashan was diplomatic. Eating disorders are medical conditions, Your Majesty, not character failures. Elizabeth paced behind her desk. Medical condition or mental illness, the result is the same. Public perception would be disastrous. Elizabeth turned to Dr. McGlashan. What would such a diagnosis mean? Publicly. Well, Your Majesty, proper treatment would require specialist care, possibly therapy, medication. And medical records? Dr. McGlashan was uncomfortable. Yes, documented treatment would be necessary. Elizabeth was cold. Unacceptable. Your Majesty? I said unacceptable. The future queen cannot have mental health issues on record. Dr. McGlashan tried to maintain his professional stance. But Your Majesty, if the princess needs treatment... Elizabeth was firm. The princess needs discipline, not psychiatry. Elizabeth returned to her seat. Dr. McGlashan, you will reconsider your diagnosis. I'm sorry, Your Majesty? This is not an eating disorder. This is pre-wedding anxiety, temporary stress response. Dr. McGlashan struggled. Your Majesty, the medical evidence suggests... Elizabeth interrupted. The medical evidence suggests what I say it suggests. Dr. McGlashan realized the precariousness of his position. Your Majesty, I have professional obligations. Your primary obligation is to the Crown, and the Crown requires discretion. Elizabeth stood again, taking a dominant posture. Dr. McGlashan, you've been royal physician for how many years? 12 years, Your Majesty. And your family lives in a Windsor Grace and Favor residence? Dr. McGlashan was nervous. Yes, Your Majesty. Your children attend excellent schools courtesy of royal patronage? Yes, Your Majesty. Elizabeth's meaning was clear. These privileges are dependent on your continued usefulness. Dr. McGlashan understood the threat. I see, Your Majesty. Elizabeth returned to a businesslike tone. So, revised diagnosis? Dr. McGlashan was defeated. Pre-wedding stress syndrome, temporary anxiety response. Excellent. Treatment plan? Dr. McGlashan was reluctant. Mild anti-anxiety medication, rest, stress reduction. No therapy? No therapy. No eating disorder specialists. No specialists. Elizabeth was satisfied. Perfect. Elizabeth pulled out a file. Now, about the medical records. Your Majesty, the official diagnosis will be pre-wedding stress with physical manifestations. Nothing about eating, vomiting, or mental health. Dr. McGlashan felt moral conflict. Your Majesty, this could endanger the princess's health. Elizabeth was ice cold. The princess's health is secondary to the crown's reputation. But if she deteriorates, then you'll manage it quietly. No dramatic interventions, no hospital admissions, no specialist referrals. Dr. McGlashan tried one more approach. Your Majesty, as a medical professional, I must advise that eating disorders can be life-threatening. Elizabeth cut him off. Are you suggesting the princess might die? In severe cases, yes, Your Majesty. Elizabeth paused, considering. How severe are we talking? Dr. McGlashan was reluctant to answer. Difficult to predict. Could be months, could be years. Elizabeth calculated. The wedding is in 5 months. Can you maintain her stability until then? Possibly, with careful monitoring. Then that's what you'll do. Dr. McGlashan tried a compromise. Your Majesty, perhaps private counseling. Off the record? Elizabeth considered. What kind of counseling? Someone discreet, no official records. Focus on stress management, coping strategies. Elizabeth was suspicious. Not eating disorder therapy? Stress counseling only, no mental health diagnosis. Elizabeth thought carefully. Who would provide this? Dr. McGlashan. I have a colleague, Dr. Sarah Richardson. Highly discreet, works with sensitive cases. Meaning? High-profile individuals who require privacy. Elizabeth was interested. What would be her understanding? That the princess is suffering pre-wedding stress, needs support coping with royal pressures. She would not be told about the eating disorder? Dr. McGlashan was ethically uncomfortable. Not officially, no. Elizabeth decided, very well. Arrange discreet counseling with this Dr. Richardson. But Dr. McGlashan. Yes, Your Majesty? If word of an eating disorder or mental illness ever surfaces, if medical records ever suggest serious psychological problems, if this situation ever becomes a public embarrassment. Dr. McGlashan waited. Elizabeth finished the threat. Your career, your family's security, your children's futures, all will be reconsidered. Dr. McGlashan understood completely. I understand, Your Majesty. Excellent. Now, about medication for the princess. Dr. McGlashan pulled out his prescription pad. Mild sedative for anxiety, diazepam, low dose. This will help with the fainting? Should help with stress symptoms, yes. Elizabeth. And appetite? Dr. McGlashan was careful. May improve appetite slightly. Good. What will you tell the princess about the diagnosis? Dr. McGlashan hated himself. That she's experiencing pre-wedding stress. Common condition. Nothing to worry about long term. And if she asks about eating problems specifically, I'll say stress is affecting her digestive system. Temporary issue. Elizabeth was satisfied. Perfect story. Elizabeth stood, the meeting ending. Dr. McGlashan, I trust you understand the importance of this conversation remaining private? Absolutely, Your Majesty. Good, because Princess Diana's successful integration into the royal family depends on her appearing stable, healthy, and mentally sound. Dr. McGlashan nodded reluctantly. Elizabeth delivered the final blow. And if she's not stable, healthy, and mentally sound, perhaps she's not suitable to be the future queen. That would be unfortunate for everyone involved. The threat was clear. Diana's entire future was dependent on the medical cover-up. Dr. McGlashan left the meeting knowing he'd just agreed to endanger his patient's health to protect the royal reputation. Medical ethics compromised, professional integrity sacrificed. After Dr. McGlashan's false diagnosis, Diana felt even more alone. The pre-wedding stress diagnosis minimized her real symptoms, but the eating disorder continued. Charles expected Diana's improvement with medication. Feeling better? Charles asked at dinner, looking at Diana's plate. Diana had barely touched her food. Much better, she lied. Good. Mother was worried about you drawing unnecessary attention. Diana realized Elizabeth's real concern was image, not health. Every evening, Diana struggled in the bathroom, trying to eat, then vomiting. The cycle continued. The medication slightly eased her anxiety, but the root cause hadn't been addressed. 1 week later, Elizabeth organized a family meeting to discuss Diana's progress. Dr. McGlashan reports improvement, Elizabeth announced in the dining room. Philip was satisfied. Good. I hope this nonsense is finished. Charles was hesitant. She still seems fragile. Elizabeth was firm. Wedding preparations must continue smoothly, no more dramatic episodes. Margaret, in a rare moment of sympathy, maybe Diana needs more support. Philip cut her off. Support? She needs backbone. Royal duty means personal sacrifice. Elizabeth agreed. Diana must understand the expectations. Royal wives endure pressure with dignity. Charles made a weak attempt. Perhaps fewer public engagements until the wedding. Philip was explosive. Fewer engagements? She needs more exposure. The public must see a strong, healthy future queen. Diana's name was discussed like an absent object, not a struggling human being. The following evening, Diana gathered courage to express her real feelings to the family. Charles, I need to talk to your family about something important. Charles was nervous. What about? I'm not getting better. The medication isn't helping. I think I need a different kind of help. Charles was uncomfortable. Diana, the doctor said stress syndrome. The doctor is wrong. Diana challenged medical authority for the first time. Something else is happening to me. Charles panicked. Diana, you can't question the royal physician. I can question a doctor who isn't helping me. Charles realized a crisis was brewing. He called Elizabeth immediately. An emergency family meeting was arranged that night. Diana faced Elizabeth, Philip, and Charles in the formal sitting room. The atmosphere was hostile. Elizabeth's cold opening. Diana, Charles says you're questioning the medical diagnosis. Diana was nervous but determined. Your Majesty, I don't think the diagnosis is correct. Philip showed immediate anger. You think you know better than the royal physician? I know my body. Something is wrong that stress medication isn't fixing. Elizabeth asked icily. What exactly are you suggesting? Diana took a deep breath. I think I have an eating disorder. I can't control my eating, can't stop vomiting, can't. Philip exploded. Enough! Diana was startled. Philip continued furiously. Self-indulgent nonsense. Royal wives don't have nervous breakdowns. You will not disgrace this family with mental illness claims. Diana's tears were forming. But I need help. Elizabeth was cold as ice. Help? You need discipline. Weakness is not acceptable in this family. Diana was desperate. Please, I'm struggling. Philip was cruel. Struggling? You have everything. Title, wealth, position. What more do you want? I want to be healthy. Elizabeth stood up, intimidating. Diana, let me be absolutely clear. You will not have an eating disorder. You will not require therapy. You will not be a mental health case. But Philip was vicious. But nothing. You will be a perfect royal wife or you will be nothing at all. Diana realized the full extent of the family's cruelty. No compassion, no support, no understanding. Elizabeth delivered the final blow. Diana, if you cannot handle royal pressure, perhaps you're not suitable for this family. The threat was clear. Admit illness, lose everything. Diana broke down, crying. I'm trying to be perfect. Philip showed no sympathy. Try harder. Charles was silent the entire time, watching his wife being destroyed by his family, offering no protection. The next day, Dr. McGlashan summoned Diana again, clearly briefed by Elizabeth. Princess, the family is concerned about your misunderstandings. Diana was confused. Misunderstandings? Your symptoms are perfectly normal pre-wedding stress. Suggesting an eating disorder is a dangerous delusion. Diana was shocked. Delusion? Stress can cause confused thinking. You're imagining problems that don't exist. Diana felt reality slipping. Was she crazy? Were the symptoms not real? But the vomiting, Dr. McGlashan was dismissive. Stress-induced nausea, perfectly normal. The weight loss, pre-wedding nerves affecting appetite, common occurrence. Diana was desperate. Then why can't I stop? Dr. McGlashan was patronizing. Princess, you're young, emotional. Wedding pressure is overwhelming. Your brain is creating symptoms that feel real, but aren't. Diana left the appointment questioning her own sanity. The family said she was weak. The doctor said she was delusional. Symptoms continued, but help was denied. That evening, Diana collapsed in tears alone in the bathroom. In the mirror, a skinny, pale reflection stared back. The eating disorder was winning. Family was abandoning. Medical system was failing. Maybe I am crazy, she whispered to her reflection. But her body knew the truth. Hunger, vomiting, weakness, all real. Family cruelty was real. Medical cover-up was real. Diana realized the sobering truth. In the royal family, survival meant silence. Admit weakness, face exile. Seek help, risk everything. The wedding was approaching rapidly. Diana was trapped between illness and image. The eating disorder was progressing while the family demanded perfection. On the eve of the wedding, Charles approached Diana. Diana, tomorrow is the big day. Are you ready? Diana looked exhausted, thin, barely holding together. As ready as I can be. Mother is pleased with how well you're handling everything. Diana gave a bitter laugh. Am I handling it well, Charles? Charles was uncomfortable. You look different, thinner. Stress diet, Diana replied sarcastically. Charles was oblivious. Well, you look elegant, very royal. Diana realized Charles never truly saw her. He saw the princess, saw the future queen, never saw the struggling woman. Charles, after the wedding, can we talk about getting a different medical opinion? Charles immediately tensed. Diana, we've discussed this. Dr. McGlashan is an excellent physician. But what if he's wrong? Charles was firm. He's not wrong. You're fine. Tomorrow proves everything worked out. Diana understood. The wedding day performance would be considered proof of recovery, no matter how she actually felt. That night in the bathroom, Diana looked one final time at the wedding dress hanging there. A beautiful gown designed for a happy bride, not a sick woman pretending to be healthy. Tomorrow I become princess, Diana told her reflection. But I'm still dying inside. The eating disorder would continue long after the wedding vows. Family cruelty would persist. Medical truth would remain hidden. Diana learned a devastating lesson. Royal women must suffer in silence. Perfection was demanded. Humanity denied, illness covered up. Wedding day would mark the beginning, not the end, of Diana's struggle with an eating disorder and a family who chose image over health, reputation over recovery, duty over daughter-in-law's well-being. She'd wear the crown tomorrow, but inside remained a broken girl the family refused to heal.